Hi, I'm Lyall Ashberg. I'm a pediatric orthopedic surgeon here at Atlantis Orthopedics. I specialize in the care of children's bones and joint problems. So in my pediatric practice, obviously lots of broken children, lots of broken bones, and so casts and splints and occasionally pins and rods and things like that. And then sports injuries like one might see in some of the adult patients with arthroscopies and surgical telescopes that we look inside people's knees and things like that. The exciting thing is the hip arthroscopy side, which is the minimally invasive access to the hip joint, which is a very deep and restricted joint to get into. And we're starting to develop techniques of getting in there, and now instead of just identifying things, we actually can do a whole lot of work inside the hip joint in a minimally invasive fashion and really affect positive change in people's outcomes. I have an opportunity to really change people's lives. Taking care of children, first of all, I get to play with kids every day. And secondly, I have an opportunity to affect meaningful change so that they don't go on to have disabilities later in life. And on those things that I can't change, I believe that we're getting to a point where we can affect significant improvement. So that's very rewarding. And then the same thing for the hip preservation patient. Things that it's an exciting field that we're constantly learning. Every single time I put a scope in somebody's hip, I learn something new. And it's a challenge. We're solving a lot of the problems, but more importantly, we're coming up with more questions which help us further our knowledge. I'm very fortunate in that I've been elected to be on the editorial board for the Journal of Arthroscopy, and so I get to review all the latest research that's being done in hip arthroscopy and hip preservation procedures, and so for me that's very exciting.